The Centers for Disease Control and Prevention says there are 64 cases of measles in the U.S. so far this year. Tonight, Cecily Stout spoke with state medical experts who explain why measles is suddenly popping up again and how people can protect themselves and others from the contagious virus.
A longtime pediatrician at Houston Healthcare describes the illness as contagious and fatal. He says people should take any measles outbreak seriously.
Right now, anywhere in the world today, there's probably going to be about 300 to 350 kids who are going to die from measles today, and tomorrow, and the next day, and the next day after that.
The reason we don't see that kind of impact in the U.S.?
One answer, and one answer only, and that's vaccinations.
Jocelyn Love is an epidemiologist at the North Central Health District, a branch of the state's public health department. She says she's not surprised this is happening.
But we do see an increase in measles cases associated with travel around this time of year. And especially with the reduced vaccination rates, it's something that we will probably continue to see.
The CDC has confirmed 64 cases of measles in the U.S. just 3 months into the year. In 2023, the U.S. saw a total of 58 cases. So far, the recent cases have appeared in 17 states. Symptoms include high fever, cough, and what can be a serious rash.
A professor once told me it's kind of like pouring a bucket of paint over your head. It just kind of goes that way all the way down to your feet.
Love says without vaccinations, measles could have the capability of sending us into another pandemic. And one of the reasons Love says people aren't getting vaccinated is pandemic fatigue. The CDC says over 61 million doses of measles vaccinations were delayed or missed due to COVID-19.
So having another pandemic right on the back of a previous pandemic could lead to those concerns that, people just might not take those precautions.
Stewart says the MMR vaccination for measles is safe and has been around since 1963, and it's helped minimize our outbreaks.
Vaccine hesitancy has always been the reason why we have outbreaks, and even today, even though our outbreaks aren't anywhere like what we had back then, the small outbreaks we're having right now are because of vaccine hesitancy.
Cecily Stout, 13 WMAZ News.
North Central Health District says the measles vaccine is available at all the state's public health departments. They do ask people who think they may have measles symptoms, don't go to the hospital, your doctor's office, or a public health clinic without calling first.